Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I would be talking about some of the common deformities that are seen in a spastic cerebral palsy child who is suffering from quadriplegia, or as you can say quadriplegic CP child. If you want to know more about this video and this topic, make sure to watch this video till the end. Let's begin. Friends, kids who suffer from cerebral palsy usually tend to show some tone abnormalities, and one such common tone abnormality is an spasticity or a spastic kind of tone abnormality. In this scenario, the child is very spastic, or I'll say the tone on the muscle is very high, and that's why any small movements will be felt very tight and very strong. And these kids are usually more prone to develop certain deformities in the body, since the tightness is very high. Especially the kids who are quadriplegic, which means both the hands and legs are affected. In those cases, there are typical deformities that usually develops. With the help of physiotherapy, the aim is to prevent these deformities so that the surgery can be delayed as much as possible and the patient or as the child is allowed to achieve maximum functional independence. But before we start any of the therapy for this, it's important to know and identify what are the common deformities that a child with spastic quadriplegia or quadriparesis experiences. Most of the time, the kids who suffer from cerebral palsy develop either a postural deformity, which means a deformity that is developed due to wrong positions or else wrong postural habits, and positional deformity, which means when a child stays in a wrong position, a wrong pose for a very long period of time. So certain areas of body are more prone to develop tightness and stiffness, which gradually turns up into deformity. If we look at this figure, which is I'm showing right now in the screen, this is a typical posture related deformity that a child with cerebral palsy tend to develop. Mostly the kids have their head turned to one side. There is always a marked pelvic tilt with spinal scoliosis, which means that the spine gradually starts turning S shape with the waistline moving outwards, and this leads to further hip deformity, which is called as windswept hip deformity. Now, these deformities leads to difficulty like sitting difficulty, rolling over, difficulty in rolling over, and decreased respiratory function. When these deformities are not corrected, gradually it start affecting other areas or other joints of the body, and then those areas starts becoming deformed. Some of the common deformities that develop secondary to these problems are knee flexion contracture, which means that the knee constantly stays bent, as well as equinovarus foot, which means that the foot is in internal movement, which means that the foot is moved or is bent inside and downwards, which leads to toe walking and other related issues. Both these things affects the child's ability to walk and stand. And that's the reason many children who suffer from cerebral palsy don't walk independently, is because of these deformities and contracture they develop over a period. And then as the age of the child progresses, even though there's no other pathology that is present in the brain, but still the contracture or the stiffness kind of gradually increase, the bone size increase, and it affects the child's ability to walk, stand independently. But when a child is newborn, these structural deformities are not present, and that's why it is very important that therapy or physiotherapy of the child should be started as urgently or as immediately as possible, and should be continued regularly. Because when you continue these exercises regularly, you can maintain first the tone of the muscle, second you prevent development of this unnecessary contractures and deformities. As the child will grow, there might be trunk abnormality that gradually develops. So how do we take care of the child? Now, the rule of thumb is first start early. Make sure to take help of a physiotherapist to understand what are the exercises that you as a parent should do throughout the day to ensure that the deformities and contractures are not formed. That's why spasticity management comes into the picture. Spasticity management comprises of regular massaging, regular active movements of the joint, which is called active range of motion exercises. Along with that, sometimes medication like baclofen injection or Botox injection, muscle relaxants are helpful to reduce spasticity. Along with this, regular exercise program make sure that the child is active enough so that the muscles don't stay in a contracted or a deformed position for a long period of time. Along with that, regular passive stretches are also important as stretching is required over the tight muscles. Sometimes functional stretching poses are the pose where an entire body is maintained in some good aligned and stretched position can be practiced to prevent contractures. So this forms an exercise part. But along with exercises, positioning plays a very crucial role. The way the child sits, the way the child sleeps, the way the child stands impacts his development of contractures in future. If you want that your child don't develop contractures or tightness around the body areas, it's important that you make sure that he or she sits or adopt good postural habits. Sometimes bracing is important. Orthotic devices like calipers, ankle foot orthosis, knee braces are good enough and are important to prevent contractures and deformities in children. Last but not the least, engaging the child in activities of daily living which encourages the child to move his joints are also a great way to prevent contracture and deformity. If the focus is on development of holistic, if the focus is on holistic development of the child, then the child also engages in other systems of the body, also focuses and works on his growth, and that kind of help the child to achieve better independence level and thus prevent stiffness and contractures. And that's why physiotherapy play a very crucial role in management of cerebral palsy. Hence, I would highly recommend you that please connect with a physiotherapist who understand your child's condition and make sure to have regular follow-up with your physiotherapist on a timely manner to understand where all the deformities are developed, and if they are developing, then how to prevent it, and also engage the child in day-to-day rehabilitation program. If you rehabilitate your child on a regular basis, you will not only delay the surgery of the child, you will not only avoid unnecessary contractures and deformities, but will also help child to achieve maximum functional independence. I hope you found this video informative. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video.